really important to raise awareness about women's health because women suffer a number of inequalities really through the whole of their lives. For example, women are 50% less likely to be diagnosed correctly with a heart attack when they present to accident emergency with some kind of chest pain compared to men. And as well, things like period poverty, so girls are much less likely to be able to afford period products. We know in the EU that only 1 in 10 girls can actually afford to buy period products. But more importantly, in some areas of the world, so for example in Africa, about 1 in 10 girls are skipping school simply because they're on their period. So this means they're not able to access the education which they really need. And then finally, we know that, for example, in the UK, women who suffer from endometriosis, which is a condition which affects and causes a lot of abdominal pain, it takes about 7 years on average for them to get the correct diagnosis and the correct treatment. So it's very clear that we need to really focus on trying to improve diagnosis. UCL is really taking a life course, a holistic approach to women's health. We're thinking about policy and innovation and ways in which we can really transform care and well-being. In terms of innovation, there's new cervical swabs which have been shown to predict the risk of developing 4 different types of women's cancers before they actually develop. And so we can then risk predict and screen women and prevent them developing these cancers. We're also optimising the care of women who have a baby loss, for example, improving the sort of way that the care is delivered across the UK with improving clinics. And we're also developing treatments for menopause. So whether you have a premature menopause, a menopause that occurs early, or you have hot flushes, there's actually very little evidence to help us work out what's the best treatment. And so we're trialling different drugs, which we think is really going to transform the care of women who have these really important and difficult problems. Menopause is a big issue. It prevents women, about 1 in 10 women actually stop working because they have menopausal symptoms, or they fail to increase their hours, they reduce their hours, and they fail to take that promotion. And of course, women of menopausal status are often the key to really experienced people in our working environment.